Welcome to the John and Rick Talk All About Insurance podcast, the show where two good old boys with over 80 years of combined experience pull back the curtain on what really works in the insurance world. Join John Smith, industry legend, marathon runner, and top producing agent for nearly 4 decades, and Rick Witcher, proud farmer, regional director, and lifelong relationship builder, as they share stories from the field, interview real agents, and show you how to build a business and a life you love. This ain't corporate. This is real talk from real agents, with a whole lot of laughs, straight up wisdom, and the occasional rabbit trail. Now, here they are, John and Rick.
Welcome again out there in listener land. I'm John.
I'm Rick.
And this is John and Rick Talks Insurance. It's called Group Agent Training. You can find us on Facebook. You can find us on groupagenttraining.com. We're going to discuss topics pertaining to insurance. We're going to laugh. We're going to cut up. We always have a guest on here who's always spectacular, who loves to talk and joke with us. And this one, I'll give you a little background because I know her very personally, and then I'm going to let Rick do most of the questions. But when I was in the insurance business, when I first started in Morristown there, when I moved back from college, I started writing a lot of agencies that dealt with adults with disabilities. And I had an agency that was owned by a couple of people, and one of them was Dr. Brooks, and likable guy, strange kind of person. I always remember he had on sandals every day. I don't care if there was 2 inches of snow outside, he had sandals on, and probably some of the hideous toes that you could ever imagine seeing on somebody. And then he would left that one agency, went over to another agency, and of course he brought me to do their insurance. And he was very good. When he opened up an agency, he'd get it started, I'd write their insurance, he'd go to another one, I'd write their insurance. So he's very good, and we became very good friends. And Stephanie, my wife, and I were doing some recruiting, and I think we'd actually sent a message out on LinkedIn to a couple of agents, and we had lunch with a young lady in Johnson City, a little pizza place, and came in and was just taken away by her exuberance, her spitfire. I mean, she was me with a female body. She was that kind of person. She came across that overbearing, mouth walks in first, kind of like me, and fell in love with her. Did not know until months after that was Dr. Brooks's daughter. And lo and behold, we got to be real good friends with her mother before she passed away. And her mom pulled me aside one day. We were up there visiting and just hanging out. And she was talking about Dr. Ben Brooks. And she said, Ben thought a lot of you. And I'm sure if he was here, he'd tell you the same thing I would. When I'm dead and gone, I want you to look after my daughter, Courtney. So, and hope that's not making you cry like it's wanting to make me tear up, Courtney. But she's been our daughter ever since. She's been somebody that Stephanie, we think of her as one of ours. Her 2 kids, we think of them as our grandchildren. We think of her husband as our son-in-law. And we love her to death. And I would say right now, to this date, as I sit here, God strike me dead, she knows more about Medicare, Medicaid, Medicare Advantage plans, anything to do with insurance for people over age 65 than 15 people you could put in a room together. She's that knowledgeable. So she's going to take some time away because I know it's still AEP enrollment, and she's going to help educate us on some things about that. And Rick, I'm going to let you ask some questions before I start crying, okay?
All right. Well, Courtney,
No tears here.
I've known you for a few years. Met you through John. Who is Courtney Brooks? What do you do?
So, well, I am Courtney Brooks. I am an agent, broker. I have done Medicare for the last 14 years, I guess. It is really my passion and kind of why I've stuck with insurance this long. It has helped a lot to know the group side, that kind of stuff. But I love doing Medicare. I am married. I have 2 kids. I have a 3-year-old and an 18-month-old, both boys, both very feral. Super cute.
Metal
but they
Blast.
are wild.
They are cute.
Yeah, they're wild. So they keep me on my toes. But I have been an agent for about 14, 15 years. That's pretty much it. I work a lot, especially during open enrollment. But try to have a little bit of a life outside of that. But all my clients have my cell phone number and they utilize that.
Right. Well, that's because you care about the phone, you know?
I do. I do very much. Yeah. Yep.
And just like my wife asked you questions last night about some Medicare folks that, she needed to know about. Uh, what do you like about this industry?
So, when it comes to Medicare, there's so much to know. There's so much to kind of learn and really stay on top of learning. When I train new agents, I typically tell them learn it this year, know the basics, forget it for next year because it's going to change. Um, and I think it's really the problem solving of I can educate someone as much as possible. I can give them, the tools to help make the best decision for themselves. And so it's not necessarily me always selling them something, but it is me educating them to make the best decision for themselves, which I think most of my clients appreciate that they understand what's going on, but they have some guidance as well. And I think that knowing the group side has helped a lot because I know how different things work together. And that's really helped a lot. But I think overall it's the problem solving and the relationships that I've made with my clients over the last however long I've done this.
Well, you said a lot there, and that is that you're helping them make a decision that's good for them. It's not about you making a sale, and that's what we find in this.
Correct.
Folks that get in it just to make a sale, they won't be here forever. It's not permanent. Um,
It's true. I have a rule that John doesn't love, and he says that it's me being harsh. It's that when I train new agents on the Medicare side, this is not the same on the group side because it's different. It's a different mindset. But I'm very protective of my old people. And if I am training you on Medicare and you ask me about commissions, usually within the first couple days of training, you're gone. We're probably just not meant to work together. And there are a lot of, changes in the Medicare market. A lot of those are financial. And so, if an agent gets into the Medicare business for the money only, I usually can sniff that out. They're usually we're not going to work well together. So those are usually gone. John tells me I'm being too rough.
No, our philosophies do coincide a lot with that. And if you take care of your clients, the commissions take care of itself.
that's right.
We've all alluded to
That's
that
correct.
fact many, many, many years. Now, you've just been in Memphis, what, 4 or 5 years now?
I moved out here in May of 2018. So
Okay,
it's
okay,
been
they're later than I thought then. Okay. And then
Yeah.
what does Taylor do again?
Taylor, my husband is a tool dealer. So he
Oh,
is not Snap-on. He will quickly tell you that he is with Cornwell. They have been around as long as Snap-on. But he has been very successful as a tool dealer. And was a mechanic before that, and it was just breaking down his body. So he is in sales also.
Okay. Well, tell us about you mentioned Medicare. Tell us about how Medicare works.
yeah.
In a brief.
I'm getting ready to turn 65 in a year and a half. So when I turn 65, use me as an example. What is my process when I'm going to turn 65? When do I need to start? What do I look for? Where do I come and put you into the play to help me? What do I need to do? Just go from there.
Okay. So it's different for every single person. If we're taking John into consideration, he's a train wreck. Love him, but he's a train wreck. He really needs the best of the best when it comes to coverage. because he's going to use it. He's definitely going to use it. So we're going to hypothetically say that he is no longer working, which will never be the case. But we're going to pretend that he is, and that he is going to draw Social Security at age 65. You are automatically granted Part A when you turn 65. As long as you have the working credits, you do have to have that. It does not cost you anything. When you turn 65, you are given that.
And Part A is which one again now?
Hospitalization.
Okay, so if I go in the hospital.
That you're given that, but I'm 67, and
Okay.
I didn't realize I needed to do something, and that was I needed to sign up for A. It was free, but I needed to sign up for it. Oh,
Usually they automatically sign you up for it.
Part A is automatic, I believe. Part B is what you have to sign up for.
Usually it's on Part B. You do have to sign up for when you turn 65. If you are no longer
I didn't sign up.
longer going to work. Yeah.
Because
And a lot of people don't.
Yeah.
You don't have to. But that is something that you do have to do through Social Security. Your local Social Security office. You can go online and do it. You can do all those things. I can't do that. I can kind of assist you with it. But I cannot do the Part A and the Part B. I can take care of everything else.
So I'm right now 60. I'll be 64 in March. Can I go ahead and sign up for my Part A and B right now? Because I mean, you're out.
No. Gotta be 3 months out.
So I've got to wait till like I'm 64 and 9 months, and then sign up for it. Okay. And when does it go into effect?
Yeah.
My birthday's March.
It will go effect. So yours would go effect March 1. It goes effective the first day of your birth month that you turn 65.
Okay.
So no matter where your birthday falls, it's always gonna be effective on the first day.
Okay.
And there's so much confusion out there because I've had people tell me all types of things. I'm still on my wife's coverage because she has group coverage. I've been told you can't do that. I said, absolutely, I can do that because I talked to Social Security.
Absolutely, you can.
As long as you have credible coverage, and as you well know, I'm type 1 diabetic, so I will need to be able to go over when I do finally go over without health questions.
Right.
But there's so much confusion out there, and it's mostly with insurance agents that have no idea what they're talking about.
Yep.
And you see that every day, I know.
Yeah, and I think that's, when I say knowing the group side and knowing the Medicare side, I kind of know how they work together. And so I think that helps a lot. Because I know that, if you have credible coverage on your, if you're still working or your spouse's, or even if you are a veteran and you have TRICARE, that also is credible coverage. I do believe the VA does make you get on Part B. But if you're still working, you do not have to get Part B. You do not have to get Part D. You do not have to get Part or Plan anything. In order to have that, you just have, you just keep what you got. You have Plan A now or Part A. There are some carriers that do require that their members carry Part A and Part B though, if you're over 65.
Right. Yeah. And luckily my wife's where she works, they're not doing that. I know in Mississippi, Blue Cross, some plans say that you have to do that, some don't, but where she works, they do not say that. So I'm lucky.
Yes, we United Healthcare.
I'm making notes because this is very, very getting close to my time here. So Part A is automatic for me, correct? That's going to happen on March 1st, when the month I turn 65. Then I have to sign up through the Social Security office for Part B 90 days before I turn 65.
Yeah, somewhere in that window.
So that takes care of my Part A and my Part B. What about C, D, E, F? What other letters are there?
Alphabet soup.
What about the alphabet soup? Yeah. What about all that?
So, usually what I do with most of my clients is I sit down and I give them kind of a broad overview of what their options are, whether it's Medicare Advantage, whether it's a Medicare supplement. Sometimes they know them as Medigap plans. But I give them kind of an educational side of it. And then if we know we want to go, the supplement route, I don't really have to know doctors because your network is Medicare. And as long as someone takes Medicare, they have to take your supplement by law.
Okay.
So, it kind of depends on the person's health. It depends on their budget. It depends on, what they've heard a lot. I would love to say that I can overcome, what people have heard from their friends, but I can't. Always. Sometimes, they have heard terrible, horrible, no good, very bad things about Medicare Advantage plans. And sometimes you can't overcome that, even if, it would fit their needs, and that's okay. But when it comes to the alphabet soup of Plan G, Plan F, Plan N, Plan C, if you're in a state that has that, that is where I come in and I kind of sit down with you and I get a full overview of the big picture that is you.
Gotcha. So again, I'm gonna ask them. I want to make sure that our viewers are hearing this correctly. Part A, you said, was hospital benefits.
Correct, at 80%.
Oh, so it's 80%. Is there anything?
Yep.
If I'm on Part A, and I don't do anything else, am I going to have money out of my pocket if I don't do something to go along with that? Okay.
Very much so. Yeah, you are.
What about Part B?
you are
Part A is hospital. Part
80%.
B is going to be what? Doctor visits or what?
Correct. Yep. Doctor's visits, anything that is done outside of you being admitted to a facility is going to fall under Part B. It is where a majority of your claims are going to go.
So where would something like prescriptions, because I'm on quite a few prescriptions, where would that come in?
Mm-hmm. That's where I come in. I do a Part D, which is your drug plan. You do have to get those through a third party. As far as, a carrier or something like that, it is not something that is provided by the government like Part A, Part B. Unless you have Medicaid, that's a whole different ball game. But the Part D is where I come into play. If you do not have credible coverage, even if you are not on any drugs, you still want to make sure that you get Part D coverage so that you are not penalized later on down the road.
Okay.
But there's lots of options out there. There's a lot of agents that are shying away from doing prescription drug plans because commissions are being pulled left and right. And it is one of the more timely things that we do. And it is kind of one of those things that, people get very upset when their drug costs a lot of money, and rightfully so. So it's important that you get put on the drug plan that best works for you and that you look at it every year. That's big also.
So it's important to sit down with my agent, like you. You're going to be my agent every year to look through my different doctors and my different hospitals and medications and kind of make sure that I'm still in my right network on everything, correct?
Correct. Yeah. Yeah. And it's, with pharmacies, they just have preferred and non-preferred. So it's a little different. You don't have to worry about networks as much when it comes to some things, depending on where you are in the country. Different states have different things. But, the main thing when people are about to turn 65, my best advice is start shopping for someone to work with more than shopping for, what you want to do. Start finding someone to work with, talk with your friends, talk with, talk with people that you work with, talk with family members, whoever, and kind of start getting some names of people that you might want to work with. And it's okay to meet with those people and not go with those people. Not every personality matches up. You want to find an agent that is, first, not a seasonal agent. You do not want an agent that you call in June and you don't hear back from them ever, or you don't hear back from them until open enrollment when you have time to move somewhere else, but they're calling you just to make sure that you don't.
You want someone
So you want to find somebody. Yes, you really want to build a relationship with somebody. They should understand your dynamics. You should be able to access them freely, not just freely as in time, but there should not be agents charging um, to monitor, make sure that you're on the right plan and that kind of stuff. I know that is our his name. Yes,
Is that
that is
illegal?
double dipping. Don't do it.
Yeah.
Yes,
Well,
don't do
I have a
it.
question about this, and that is, uh, can you talk a little bit about Part D? There's all these questions about how it works, and I think that's really important, especially with people that are on, like you said, John's on medications. As you know me, I'm on a lot of medications because of my diabetes.
Yeah,
So tell us a little bit about how Part D works, which is the drug part of Medicare.
that is the drug part. Yeah, yeah. So every person really needs a drug plan. If you have a Medicare Advantage plan, most of those have a drug plan built into it, um, which is, important to have. It is important that you find someone to work with, like I said, and give them a full list of your drugs, even if it's something that you just take, if you've had a heart attack previously and they give you the nitroglycerin tabs. Hopefully, you don't need that, but it's something that you need to make sure is covered because you could need it and you need to keep it filled. It's important to tell them what pharmacies you want to use. It's important to, really be transparent in what you're on, not because, we as an agent are sitting back saying, oh, no, I don't want to insure them. Oh, no, I'm not going to do that. It's that it can make a very big difference in what you are paying copay wise. There is no donut hole anymore. That is something that people were always really confused by, and rightfully so, because it really didn't make sense to anybody but the government. Um, but that has gone away. That is no longer. Um, but now for 20, yeah, no, it's a great thing that it's gone. Um,
So it's just a
it's capped
copay
at
like your medical
$35.
insurance is now, correct? Okay.
Yeah.
Well, I'm really asking
Yep,
the
it is.
question because I wasn't sure.
Yeah, yeah, yeah. No, it is. And then insulin is capped at $35 as long as it is on the formulary. So that is something that I have found this year. A lot of formularies are not including
very much
certain insulin.
Exception, yeah.
Yep.
Oh,
They have to be on the formulary. Yes. Go ahead, John.
Medicare, Medicare Advantage. That's the big thing that I hear differences between.
Yeah.
Please
Yeah.
explain a little bit of that, would you please?
So Medicare Advantage really takes this is where you got to follow. They take A, they take B, and they take D, and they combine it all together, and it is a Part C or a Medicare Advantage plan. Part C and Medicare Advantage are the same thing. They just have different names.
Okay.
and if I'm
Those
correct, you're
are-
really no longer insured by Medicare. You're insured by an insurance company. Is that right? Mostly?
Um, yes. In layman's terms, yes, you are. Medicare is no longer responsible for your care.
Mm-hmm.
I give the example of the bucket. This is something that I learned really on in Medicare as a captive agent with a company in East Tennessee. You have a bucket. Imagine that you have paid Medicare taxes into this bucket and you continue to pay for Part B into this bucket. Somewhere in Washington, there's a bucket with your name on the front, and that is your Medicare bucket. With that bucket, that is what Medicare pays your claims out of. So Medicare is paying claims, paying claims, paying claims.
Okay.
When you go with a Medicare Advantage company, your bucket is no longer managed by Medicare. Your bucket is now managed by Humana, Cigna, Blue Cross, Aetna, United Healthcare, whoever you select. So you still have to maintain Part A and Part B. So you do still have Medicare. The common misconception of you don't have Medicare anymore is not correct. You do still have
Yeah, that's
Medicare.
why I asked the question. Yeah.
Mm-hmm. You do still have Medicare, but they are no longer responsible for your care. So they decide approvals, referrals, and that is where people kind of have their issues in that they don't want an insurance company telling them what they can and can't do, what a doctor can and can't do, and I respect that. But on the flip side, um, we do that now on traditional insurance. I mean,
Yeah.
if you have health insurance, whether it's through Blue Cross, Humana, whoever it's through, you are being told what a doctor can and can't do based on, what you have. I'm gonna have to stand up and walk for a second. I have a client coming in. Um, but that's something that's kind of a big deal. A lot of people don't like, having that, responsibility. So, with that said, a lot of times, that people don't like a Medicare Advantage plan that kind of tells them what they can and can't do as far as where they can and can't receive their care. Sorry.
Well, my question I think would
Um,
be, like you mentioned, John, and of course, John and I've been friends for 30 something years,
Mhm.
and you know my health situation. In most cases, we would probably be better with a Medicare supplement along with Medicare Part A and B because of our medical.
And a D plan.
Yes, yes.
Yeah. Yes.
Oh,
Yeah, and it's something, I typically tell my clients, I don't want to put you on anything that I would not want for my parents if they were still around. My mom was not in great health and had someone come in and moved her to an advantage plan. We those are fighting words. But she was very she wasn't unhealthy. She had multiple sclerosis and she was diagnosed with it when she was 21. So, she was 70 when she passed away, and that was something that we were able to go to Vanderbilt. We were able to, get her the best care possible when she was alive. So, and that's, but again, it's not affordable for everybody. Supplements are increasing really by the second at this point.
well,
Um,
and
so
I know you got somebody coming in, and Courtney,
yeah.
Rick and I are so
Yeah, we
appreciative
appreciate you.
of you taking time
Thank you.
before you had an appointment, especially during the A&P enrollment. You got 1 week left to get people done. I just want to clarify.
7 days.
I understand when I'm turning 65, I reach out to you. You guide me through everything. You tell me what I need to do. And I trust in you 100%. And that's what everybody should do.
It's, and I speak at a lot of different things. I work with the DA here in Fayette County a lot. I, speak at a lot of different things. And what I always tell people is my personality is not for everybody. I can be a little loud. I'm a little, honest, maybe too honest sometimes. My mouth does walk in first. John is right. And so I am not for everybody. But what I do encourage people to do is to find somebody to work with. It doesn't have to be the same person that your brother, your cousin, whoever works with. But find somebody and build a relationship with them because you should be able to call them, text them, you know, give them a few days to answer because sometimes life's a little crazy. And we are human, so we do forget stuff. I have about 800 plus Medicare clients, and I can usually tell people, hey, this is so and so. And after a few minutes, it jogs my brain, and I can tell people, what they have, what they need. Um, I pride myself on that because I truly get to know most of my clients. And everyone should really have that. I mean,
Absolutely.
65 is not old anymore. Um, Heck, 70 at this point isn't really old. Um, but, that's something that you need to have somebody with you. Yes, you can do a quick Google search and, see what's out there, but, it pays to have somebody with some experience.
Yes, ma'am. Well, Courtney, thank you so much. And we'll let you get back
Of
to
course.
your clients that came in. We appreciate you. When AEP gets over, we'll reach out to you, hopefully interview you and talk to you some more. But we sure love you. Thank you so much.
Thank you, guys. Love you both.
Thank you. Bye-bye.
Bye, guys.